So good morning, everyone. This is Dr. Anthony Chang. We're having another AI Med talk that is going to be virtualized for all of you. And I'm so happy to have a special guest today, Dr. Todd Ponsky, who is a renowned pediatric surgeon from Cincinnati Children. So welcome, Todd.
Thank you for having me.
So I know it's inevitable that we're going to start the conversation with the ongoing pandemic. Although I think some of us are getting a little fatigued, but it's still important to, I think, keep a great perspective. So as we were chatting this morning, I think my concern about the ICU care aspect of COVID-19 is actually even more than the capacity, and we're trying to flatten the curve so that we can accommodate all the sick patients, is I think there's an advantage in having some knowledge transfer during this period, because it's literally a new virus, a new disease. And my ICU friends are saying that there's quite a bit different about the lung disease that they're seeing here. So now you're very big on knowledge transfer. How would you pursue this as a surgeon, as someone who spends a lot of time in the ICU?
Right, so the key of knowledge transfer is how are you going to transfer the knowledge, and what knowledge are you going to transfer? And that's the problem. So both require novel digital technologies. Number one is, what's the platform that people are actually going to pay attention to? How do we get everyone together? And the second thing is, how do we filter what's important, what's need to know? So to go into specifics, I think that the key thing is finding a communication network channel that people would actually use that work well with all different types of healthcare professional lifestyles. So the second thing is, it has to be a trusted network. And when there's too much information from too many people that are creating noise, it's going to be hard. So a platform needs to be created that everyone would agree on, that would help narrow down specifically what you need to know. And I know that there's a lot of ways of doing that. Number one is crowdsourcing, and number two is applying AI to help figure out what information is important.
Yeah, I think in 2020 with this disease, I used to do a lot of ICU, and I'm still getting texts from my ICU friends on either WhatsApp or just SMS about any tricks about ARDS. And I think I'm almost embarrassed to say that we need some human intelligence to transfer this information. In a way, it's kind of like artificial intelligence. We need some easier way of transferring this information. I'll give a very concrete example. Now they're finding that proning patients on oxygen and avoiding intubation seems to be a good strategy, at least for some patients, or maybe early in the disease, and letting them have the appropriate breathing exercises, which seems to me a little bit odd after 4 months with the disease that we're just kind of wandering into that. I'm sure some intensivists have tried that, but how do we efficiently transfer that knowledge during especially a health crisis is, I think, something we need to work on.
Right, so with the current crisis, we're seeing something that exaggerated what we already knew. There's too many channels, and you don't know which one to pay attention to. So like you said, I'm getting emails from some people, I'm going to websites for some things, I'm reading chat threads on WhatsApp. So it's no one's agreed upon an agreed upon channel, and you're getting disparate information from all of them. So for something like that, proning is a great example because it was so fast moving. We always knew about proning, but now we're talking about using it earlier. And that's something that can't wait 6 months to get out there. So if there was a way that would rise to the top on a platform that everyone agreed upon, that it gets rid of all these other channels. It's one that that's the hard part, is finding something that everyone would agree upon using.
Right. So now with traveling at least partly decreased, I love your vision, and I actually use your video clip in some of my talks about how you see mentoring or telementoring to change in the future. If you could just, in the last minute or so, tell us about that.
Yeah, so, as a surgeon, I'm going to focus this on surgery right now, but we are, you have pilots, always have a co-pilot, but surgeons are oftentimes by themselves in a community where they're doing an operation that gets into a space they're not comfortable with. It would be great to have another expert there helping them. So we've been working for years on surgical telementoring, where one surgeon could actually beam in the room and guide that surgeon both with telestration and pointing about how to take that operation and make it safer. Now, we're not talking about taking a novice and having someone there telling them what to do. These are trained surgeons who might just get some interaction from others. And we have found that we've been measuring the success of this, and it absolutely needs to take place. There's other issues like medical legal that could get in the way, but this is the future.
So in other words, the humans get in the way of this.
The humans get in the way, of course.
And I think there's something to be, I know you often talk about the junior trainee benefiting, but I think it benefits the senior expertise on the panel if there's more than one, because this is how peer review ought to be done, is live demonstration of a surgical procedure, right?
So a lot of different things brought up there. So number one, the method of peer review. I think our method of peer review is exactly in real time, like you said, and it's also more of a crowdsourced peer review rather than individuals that we select should be the peer reviewers. There's a great role for the more senior practitioners. Number one, those who are surgeons who may not be able to actually operate anymore still have the skill set and the know-how. And them talking together, two people talking always brings everyone up. It elevates the entire thing. And we've actually said there should be two surgeons watching and telestrating. Yeah, absolutely. By the way, Anthony, just in your space, and you know I'm interested in this, one element that we are working on, but working with someone more who's smarter than us at doing this, would be to apply AI live. That could we use image recognition when a surgeon's doing a case to not only have someone telling them advice, but what if it could implement the CAT scan and say, careful, you're heading towards the hepatic artery. So we need image recognition to be implemented into the system, not just humans.
Well, in a way, we're already seeing maybe a primitive version of this with gastroenterologists using real-time AI to determine which lesions to biopsy. So I think your vision is going to be realized sooner than you think. So Todd from Cincinnati Children's, thank you so much for joining us this morning.
Thanks for having me. This is great.